However, before we get to the break, let's now cross over and get a full-length interview with the minority leader in the National Assembly and the ODM party chairperson, John Mbadi. Good morning, Mheshimiwa. Appreciated, and thank you for joining us here on the broadcast. There are, of course, reports of 17 members of parliament testing positive for the coronavirus crisis. From where you sit, how authenticative can that be, and are they substantiated?
Thank you very much. Good morning. And first of all, I would like to say that these are really trying moments for this country. But now coming back to your question, this story about 17 MPs possibly testing positive, I think is sensational. It has no basis. First of all, I think it is irresponsible and immoral for the Star to carry such a story. To me, it's like the Star is selling panic, which is very irresponsible for them. I've tried to talk with a few of them just to find out where this story is from, and it has no basis. In fact, if you look at the headline and you look at the content of the story, there's no linkage, there is no nexus. It's completely disconnected, and that to me is unfortunate. First, there would be nothing really wrong. It would really be unfortunate for 17 MPs among a sample space of about 50 to be positive, because then that would be very indicative of widespread infection in the country, which would cause panic to the country at large. Not because they are MPs, but because they are Kenyans. And if you can sample about 50 Kenyans and you find 17 of them positive, that would really cause panic. However, that I don't think is possible. And it should go out clearly that MPs took voluntary tests, including myself, and the results are being sent directly to MPs, to individual MPs. And so it is very difficult to know what the result of another MP is. As late as yesterday at 5, the results had not even started being released. Mine was released to me at about 7:15. I was told, and then they sent it through an email. And I can see in the social media, some people have started adding 1 + 1 and creating a list of the 17 MPs, and I'm always number 1 in the list.
Okay.
But I want to put it clearly that personally my result is negative. If it was positive,
okay,
I would just come out and say I'm positive. And those who have been in contact with me, although there have been very few, have been keeping largely at home.
All right.
But it would be important and responsible to tell Kenyans who have interacted with me to be cautious, isn't it?
All right.
So that we stop the spread. There's really nothing to stigmatize about this disease. I think we need to be clear that this is a flu kind of disease. It is too infectious. That is why we are being careful. But it's not about turn of life and death, you see? So that is my view. So in a nutshell, I think the Star has behaved irresponsibly.
All right. Given that, of course, you in 2013 said that the money that was used in the construction, in the revamping of the new parliament, where a seat costs about $3,000, 300,000 Kenya shillings, that money can set up a house for a common mwananchi elsewhere in the country. And we are in a country where we have 518 ICU beds, 414 trained nurses in ICU, and that is what we need most in the midst of this calamity. And talking of generally a deficit in equipment and essential drugs in our hospital system in the country, why do you think we lack the magical thinking and we are now in the midst of this problem, and how can we get out?
No, first of all, I think we also need to agree that this is a pandemic that has engulfed the whole world. It's a global problem, it's a global crisis. Even the very capable countries have been hard hit. You can see Italy is on its knees. You can see the mighty America is humbled. You can see Spain is facing the worst crisis that has ever faced. So Kenya is not in isolation. We are not. It would be wrong for us to say that it is Kenya that is ill prepared to confront this pandemic. I think we are all as a global community. However, as a country, we need to look internally and see how we can respond quickly and effectively to this pandemic. And I've personally communicated with our committee, because you see Parliament's role is oversight. Our health committee, I've personally communicated with the health committee and our members who are in that committee to look at our level of preparedness. I am still not very certain and convinced that we are fully prepared for a widespread infection of this disease, because if you look at the counties are not properly prepared. But I have also to congratulate the national government for trying to respond, although we need them to go a notch higher. My only concern at the moment, and I've been hearing a lot of talks here and there, they may be informal talks, but sends a lot of message, a very strong message, that some people still want to make money out of this unfortunate situation. You hear many people in the counties are trying to look for ways of using this crisis to circumvent some procedures just to make money. And I would say that would be the most irresponsible, and making money out of people's blood would haunt these people forever. I just want to caution those who are responsible, those who are being given resources, to implement and to buy equipment and to prepare for this pandemic, that if your greed takes you to the level of compromising the lives of Kenyans, then the blood of those Kenyans who are going to die as a result of your greed will be on you and your children and the great-great-grand and the grandchildren.
Okay, acknowledged, appreciated that it's always a global phenomena. But having mentioned the example you provided, in the United States of America, Donald Trump misjudged the situation, called it the Chinese virus in the White House press briefing room. And now America has the highest number of cases. And that was misjudgment, as was the case in Japan with the government of Shinzo Abe, the prime minister. Back at home, though, we have Abe and Trump's version in the names of Transport CS and former Cabinet Secretary Health, Cicely Kariuki, in allowing the touching down of a Chinese flight with 239 passengers on board. The Kenyan who shot that video, allegedly, they said, will be, of course, charged with terror-related charges. He is the hero at the moment, and the government is fumbling in terms of its measures, which are porous. Isn't it irresponsible that the government allowed that and shrouded the entire process in secrecy?
Well, I would agree. I can't agree with you more that initially I think there was a bit of miscalculation and mishandling of the process. I think maybe some of us, maybe government officials, were not imagining that this disease would get to this country, which I think was lack of foresight on the part of those officials who are responsible. We probably were about 2 weeks late. We should have closed our airspace a little earlier, our airports a little earlier, and refused to accept international flights to this country. Because you'll agree with me that the first cases that were spotted in this country were all people who returnees, those who travel from other countries to this country. And so you probably, if we took an earlier step to stop the flights at that time, then probably we would have closed our borders from this disease. But again, we are part of the global community. It was going to be very difficult to completely keep this disease at bay. However, I think later the government has responded well after that first initial mishap. To me, if you ask me, I think the government has responded well. You can see we have closed. There is completely no traveling to this country and traveling possibly out of the country. And we have moved a step further to even close Nairobi and 3 other counties. I think we may go a step further and just say there is no inter-county movement, or even move a step further and completely shut down or lock down towns like Nairobi, Mombasa, and those hotspot areas. But anyway, to generalize and judge the government, I think the response, if you were to give the government a percentage, probably they score 60%, meaning 40% was laxity on the part of the government. I agree with you on that, but we are where we are. I think we now need to be positive and proactive, and henceforth, how do we then now manage a disease that is already in the country? I think that is very important. Unlike Trump, I think our president has always taken this disease so seriously, this pandemic seriously.
Okay, as we finish up, one final question. You have mentioned the aspect of the inter-counties, and which is equally important, but let me get your judgment on the absence or the lack of the collective endeavor on the county governments and the national government front on the recruitment of 5,500 healthcare workers, and why at this time of need they are at loggerheads instead of the convergence of efforts in the fight against pandemic?
Yeah, I think this is a time that we should avoid unnecessary fights about tough wars and the ego fights about who is responsible for what. I think this is a time that we should not even be delaying the recruitment of the 5,000 workers, basing it on public service commissioners to do the recruitment. Let us get professionals, okay? Because we have many of them.
Right.
We could even just say first come, first serve, because these are all trained Kenyans, isn't it? So there's no need even to conduct an elaborate interview, wait for the process. There is no time. This disease cannot wait for those procedures and logistics. The other thing that I wanted to say as I wind up is I just want to appeal to the government that let them use the 21 days of locking Nairobi, Mombasa, Kilifi, and Kwale to do mass testing for residents of those areas, because there would be no logic of closing them down for 21 days and then opening them up after that.
All right.
Unless we do mass testing and get the people who test positive to be quarantined, to be isolated from the rest. Not to be quarantined, but to be isolated, so to speak, and those who have been in contact with them to be quarantined. That is when then it will make sense to close Nairobi, Mombasa, Kwale, and Kilifi. Because if we just close them for 21 days and open them up, there is nothing really you have done. But on the side of the health workers, let the government move with speed. Let there be no ego fights between the Council of Governors and national government. It doesn't matter who recruits what, so long as they get professionals who are Kenyans, who are volunteering and coming out. Really, I know Kenyans are unemployed, but coming out at this time to offer yourself to help fight this disease, I think is a sacrifice, in my view. So those Kenyans who are ready to do it, let them do it.
All right. Asante sana, Member of Parliament at the National Assembly, the leader of the minority party in the National Assembly, and equally the ODM party chairperson, John Mbadi, joining us by way of phone here on the broadcast in regard to the measures that need to be adopted by the government in the fight against the pandemic in the country. We still have some stories in regard to the country, what's happening across the counties, the effect so far of the restriction of the movement.